A lot of women always talk about menses in pregnancy. A woman will tell you, when I'm pregnant, I still see my menses. Some will come to the hospital to ask the doctor, why is it that when she's pregnant, she's still seeing her menses? Ladies and gentlemen, I am teaching today on bleeding in pregnancy. Once pregnant, there is nothing like menses. There is nothing like menstruation. Remember, we defined menstruation as the weeping of the disappointed uterus, the disappointed womb. So, if your womb gets a pregnancy, it is not disappointed, so it doesn't weep. There is no drainage like menses once confirmed pregnant. Now, I want to draw your attention to the fact that any bleeding from the vagina during pregnancy is a danger sign. I will come to that topic in a subsequent video to teach the danger signs in pregnancy. But my interest today is on bleeding in pregnancy. I am still to teach us all what pregnancy is all about, how it develops, the signs and symptoms of pregnancy, the changes that pregnancy brings to the system of the woman, and we shall get into antenatal care, quality care of a woman during pregnancy. All of this shall be handled in subsequent videos. Let us look at causes of bleeding during pregnancy. As I have just said, when you confirm that you are pregnant, anytime you notice blood coming from your vagina, even if they are just drops, spots of blood, it is a danger sign necessitating immediate consultation at the hospital, in a health facility. You meet a doctor, you meet a health worker, so that the earlier the cause is determined and managed, the better for the life of the woman and the unborn child. Because any form of bleeding at any time during pregnancy is a danger sign. What are the causes of bleeding in pregnancy? I am going to group them into two. Causes of bleeding in early pregnancy, and we will also look at causes of bleeding in late pregnancy. Now let me look at you. Early pregnancy, we are referring here to any pregnancy before age of viability. In the developed world, age of viability may be as low as 22 weeks, 24 weeks and above. Now, in our own setting, Africa, the developing world, Cameroon, Bamenda in particular, where I am, early pregnancy is any pregnancy before 28 weeks. Any pregnancy that is not yet up to 28 weeks is here described as early pregnancy. And then late pregnancy is any pregnancy above 28 weeks. From 28 weeks and above, right till term, that is late pregnancy. There are certain disease conditions that are responsible for bleeding in early pregnancy, and certain conditions responsible for bleeding in late pregnancy. Now, let's look at early pregnancy. If your pregnancy is still in the early stage, maybe 1 month, 2 months, 3 months, 5 months, since you like calling it in months, Okay, I will teach one day on why pregnancy duration should always be stated in weeks, not months. That day, that video will come. For now, you can refer to it in months or in weeks. If you are a health personnel, you already understand why. But what are the causes of bleeding in early pregnancy? One, when you notice that there is blood, even if there are just drops of blood coming out from your vagina when you are pregnant. One, abortion. Abortion is interruption of pregnancy before age of viability. Any interruption, whether you, the woman, you are responsible for trying to terminate it, or it is happening spontaneously, it's happening on its own, that you don't seem to understand what is happening. Sometimes some women get pregnant and it's a precious pregnancy they have been begging God for a very long time, okay? And the pregnancy comes and sometimes they start feeling some pain, lower abdomen, waist, and before they know it, they start bleeding, and then finally they lose the pregnancy. That is abortion. It is only when we are talking about the types of abortion that we see induced abortion and spontaneous abortion. Spontaneous abortion means that you are not the cause. Certainly, there might be some disease or some complication in the body which you didn't know, or something, unfortunately, but you see your pregnancy going out, you are trying to do everything for it to stay, and you end up losing the pregnancy. If you are not the cause, then it is spontaneous. But if you decided that I want to terminate this pregnancy, whether you went and met a doctor in the hospital or whatever health expert or whatever in any medicine store, whatever you have been doing in the quarters, any attempt to take some medicine, drink, insert some, like many of you do, it is induced abortion, unsafe abortion, where we will one day be handling these causes of bleeding one after the other, so that we'll get into the consequences of these various conditions. I will teach abortion again as a topic, as a video on its own, subsequently. So you can see abortion. What people call miscarriage is spontaneous abortion. But if the person is responsible for trying to terminate it, inducing the abortion, you see, they call that one abortion. A lot of lay people believe that that is what you now call abortion. Yeah, but both induced and spontaneous is abortion. So the word miscarriage is coming in just to replace the word abortion, but it is abortion, spontaneous abortion. That is one cause of bleeding in early pregnancy. Two, ectopic pregnancy, a pregnancy implanted outside the uterine cavity. I think I taught the lesson that you saw how the womb is formed and how the inner lining of the uterus looks like, and how before implantation there is the formation, the proliferation of a decidual lining, okay, fertile enough to receive the fertilized egg and implant inside. That's the inner lining of the womb. That is where pregnancy should implant in every normal circumstance. When pregnancy, when the sperm fertilizes an egg, then you have the fertilized egg. That egg stays in the fallopian tube and implant there. It is ectopic pregnancy. If it stays around the ovary and implant there, it is ectopic pregnancy. If it even bypasses the womb and comes down to the cervix and implant in the cervix, it is ectopic. If it even gets into the fallopian tube, ruptures the tube, fall into the abdominal cavity, grows inside the abdominal cavity, it is ectopic pregnancy. As far as it is outside the uterine cavity, it is ectopic pregnancy. This is the reason why you will notice some women bleed during pregnancy. So the earlier they diagnose that, oh, the pregnancy is sitting in the wrong place, and so there's rupture already, down this bleeding, the better. Number three, molar pregnancy. Sometimes a woman gets pregnant, the embryo implants quite all right in the womb, but you know, a disease eats it up. It transforms it into a mole. You see, The womb, a woman sits and believes that she's pregnant, but what is growing in her womb is a mole. It starts forming some grape-like structures, which are like grapefruits, rounded, filled with fluid inside. If you touch one, it is really slippery. If you press it, it gets burst, and water comes out from it. You start seeing this kind of thing molding and fill the whole womb of the woman. Yeah, it's dangerous. That's a disease. The woman will start bleeding because the womb will overstretch, will grow faster than the normal growth of the womb during pregnancy. If you even do pregnancy tests, it will be very positive. Now, somebody may quickly tell you that, congratulations, you are pregnant, because they have just taken your urine and checked in the lab. Whereas more needs to be done to confirm that it's a pregnancy and not a disease. So molar pregnancy can also be responsible for bleeding in early pregnancy. Then local causes come as number 4. When I say local causes, what do we mean? From the vagina into the cervix. If you have a wound on your vagina and it bleeds during pregnancy, it's a local cause because it doesn't affect the pregnancy inside directly. If it is at the level of your cervix, maybe there are cervical polyps or some bruises or some sores at the level of the cervix and they're bleeding, then you rush to hospital and we discover that, okay, the bleeding is coming from this level. The pregnancy inside the womb is intact. That one is a local cause. Okay, so sometimes some ladies keep long nails, some of them practice very rough sexual intercourse and end up wounding themselves, and then you wear pants, soon you want to remove, you see blood. Yes, you are alarmed, come to hospital. The experts will determine that this is a local cause of bleeding in pregnancy, and then they can manage it. But what if it was deep? So the issue is, once you notice bleeding, please rush to the hospital, rush to the nearest health facility. These are only causes in early pregnancy. In the next video, I will be discussing the causes in late pregnancy, causes of bleeding. Once pregnancy is more than 28 weeks, we will be looking at the causes in the next video. My name is Dr. David Ayim. I hold a PhD in public health. I am a reproductive health expert. I am your midwife. Subscribe to this channel so we can study. Okay? Like, share it. Everyone living on the surface of the earth needs this discussion. You can ask your questions or comments on the comment section, or call me or write to me on WhatsApp. 674-60-5469. But if you're out of the country, you just need to add the word +237. Thank you. That was that for today.